Hello, today we will be talking about type 2 diabetes mellitus. We'll be looking at the impact of type 2 diabetes on the body, epidemiology, interventions, and preventative strategies.
The impediment of glucose control has an overarching effect on autonomic control and regulatory pathways such as in the cardiovascular, nervous, renal, and optic systems. In the cardiovascular system, this causes arrhythmias and plaque buildups, which lead to exercise intolerance, ischemic heart disease, and diabetic cardiomyopathies. All of these which are regulatory caused by a cascade from the glucose innervation has on the nervous system via neuropathies causing the oxidative insult resulting in loss of conductivity and neuroplasticity.
Diabetes leads to high blood sugar, which damage the vessels in the retina, preventing blood to reach the retina, hence vision impairment and blindness if left untreated. Blood finds alternative pathways through growth of abnormal blood vessels likely to rupture and lead to further visual impairment. In the renal system, the high blood sugar damages the glomeruli, which is the filtering unit, and it increases the permeability of glomeruli basement, which results in leakage of proteins in urine, causing proteinuria, one of the signs and symptoms of diabetes.
Okay, so who is actually affected by the disease? So here are some key statistics from World Health Organization to demonstrate a significant burden of the disease at the global scale. So in 1980, there were 108 million persons with diabetes. By 2014, there were 422 million. Compared to high-income countries, the prevalence has been growing more quickly in low and middle-income countries. Age-specific diabetes death rates increased by 3% between 2000 and 2019. And type 2 diabetes affects more than 95% of those who have diabetes. Looking now specifically in Canada, it was recorded that about 30% of Canadians live with diabetes or prediabetes, and about 10% live with diagnosed diabetes, which can increase to 50% when undiagnosed type 2 diabetes cases are included. Moving on to the risk factors. So the risk factors of type 2 diabetes are actually well known and defined compared to type 1 diabetes. In fact, a number of variables, including genetics, social, environmental, and personal, contributes to the disease. So people of African, Arab, Asian, Hispanic, Indigenous, or South Asian heritage, as well as those who are older, those who have less education or money, those who are physically active for less than 3 times a week. So those who lack physical activity, those who are overweight or obese, those who have a family member with the disease, those who have ever given birth to a child that weighed more than 9 pounds, or those who have experienced gestational diabetes, those who have prediabetes, high blood pressure, high cholesterol, or other fats in the blood are more likely to acquire type 2 diabetes.
It is important to understand the diagnosis of diabetes and the different tests that we can use to diagnose it. We depend on a comprehensive methodology that employs critical diagnostic technologies to properly diagnose type 2 diabetes. Consider the hemoglobin A1C test, which provides us with a consistent perspective of blood glucose levels over 2 to 3 months and serves as a dependable measure for average glycemic management. The dynamic oral glucose tolerance test observes the body's real-time reaction to a glucose challenge, offering critical insights into glucose metabolism and detecting possible abnormalities such as reduced glucose tolerance. The fasting plasma glucose test, of course, comes into play, detecting blood glucose levels following an overnight fast and providing us with a picture of the body's fasting glycemic condition.
Effective type 2 diabetes management includes a holistic approach that blends pharmaceuticals with lifestyle changes, as well as taking into consideration physical activity and diet. In the realm of pharmaceutical approaches, all medications decrease blood glucose levels. Some medications like metformin improve insulin sensitivity, and some like Ozempic stimulate insulin production. Non-pharmaceutical approaches are very important as well. Lifestyle modifications like a low-sugar, high-fiber diet are shown to increase insulin sensitivity. Stress management techniques are also shown to improve insulin sensitivity, as stress is associated with high blood glucose levels, as well as hormonal changes that lead to insulin sensitivity. Ongoing research continues to offer new insights into refining these strategies.
Ongoing research for new treatments and preventative strategies are essential as the prevalence of type 2 diabetes is increasing worldwide. Current preventative strategies for type 2 diabetes include changing lifestyle factors and behaviors. Understanding the cognitive aspect could be pivotal to preventing diabetes, as the role of the central nervous system with behavior is substantial. Additionally, the interplay between lifestyle factors, gut environment, and genetics may be the key to discovering successful preventions. Furthermore, there's no cure for diabetes, so it's essential to have effective treatments. One example is clinical trials to test new treatments, such as the glycemia reduction approach. Current studies have discovered using one treatment alone isn't sufficient enough to treat hyperglycemia. Therefore, experimentations are directed at which two mechanisms work best together. When conducting research on this, it's crucial to consider side effects and long-term health concerns when combining medication.